So what we figured out was with the post-COVID patients, the lobes of their lungs are actually sticking together as they recover. So normally you've got three lobes to the right lung and 2 lobes to the left lung. And usually the lobes where they back up to each other, they glide against each other. And what we're finding is that they're stuck. So they can move a little bit this way, but they can't have their normal motion. So they don't have the lung capacity that they normally would have. So when you're working on a post-COVID patient, the first thing you'll notice, and this is Diane, she's had COVID. The first thing you're going to notice on a post-COVID patient that hasn't had a lot of body work yet is that when you push down on their lungs, it feels like one of those hard rubber balls versus like an inflatable ball. So the goal really is to get their lungs moving again so that they can breathe again. And what we're finding is that when we do this treatment, we can generally get oxygen levels to go from 91 to 97, usually within an hour. Most of the people I've worked on, it's taken 3 sessions to get them back to where they felt normal. The second one is pretty violent and intense though. So not going to lie about that. So the first one, you're just really going to open them up and start stuff moving. Generally, I start over here since I start with the right lobe. The first thing I do though is I always check bone density, because if they've got a bone density issue, you don't want to break anything. And the best way I've found to check bone density is to put your fingers on the bottom ribs and rock them back and forth and make sure they move. If these don't move, don't do this. You don't want to hurt them. So I start over here, which is where the 3 lobes of the right lung come together. There's a lobe here, there's a lobe here, and then there's a lobe in the front between the 2. So it looks like a triangle almost. So I put my hand in here and start wiggling this just to get it moving. See if you can get the lobes to move any. Sometimes when the lobes come apart, it actually sounds like Velcro tearing or bubble wrap popping. After you do this for a little bit, you'll find that you've got a little bit more motion going on here. So then you're going to switch up to here, which is where, it's right about here. It's where the upper and the lower lobe meet. Also, if somebody's got a cardiac stent, don't do this, because that's the last thing you need to knock loose. So I'm pushing down on the bottom lobes of the lungs, just getting them moving a little bit. And then you get more intense, and you're actually rolling this lobe of the lung away from the top lobe of the lung. I'm pushing down towards her hips, not into the table. You're going to switch sides, and you're going to push the top lobe away from the bottom lobe. I do each lobe individually just to make sure I get it. Okay, so I'm going to push down on the left lower lobe here, trying to get this to move. It's pretty violent. You can see her moving. It's a very active technique. There we go. And my hands are meat hooks, so that helps. There we go. It's starting to move now. I'm going to come across over here. And I've probably got, what, 6 pounds pressure? 5 pounds maybe right in there? A gallon of milk weighs 8 pounds, that's how I remember. Lean on me. Okay, let's see if we can get her ribs to engage. Let's see if we can make them play nice together. So I've got all my body weight on her right now. I've got the heel of this right hand is basically at the border where the lobes of the lung come together, and then I'm directing her rib cage down. Because the lungs are actually stuck to the inside.
Again.
A little bit. Not as bad as it was. There we go. See, my hands are starting to shift. Good job.
And with COVID patients varying in symptoms, have you been seeing like a pretty consistent, whether they were like asymptomatic or not, with these kind of like lung sticking?
What's interesting is the ones that were asymptomatic when they had it, and then they have lung issues later.
I had symptoms, but I had zero cough. I really didn't have respiratory symptoms except for getting out of breath when I was talking on the phone.
Me too.
Yeah.
So
Good. Oh, look. Yay, it moves. So I'm going to go over this one again. Okay, I'm going to have her roll over now. All right, breathe in, out, in, out. I'm checking her rib motion here. In, and there was a wheeze right there. Oh, out. Yeah, there was a wheeze and a thunk right here. So that's fun.
What does that mean?
Something stuck. All right, this is the other part of the post-COVID thing, is when the lungs are actually stuck to the inside of the skeletal structure, you need to kind of break them loose a little bit. Okay, so I've got my fingers on this rib. My thumb is on the first rib at the costovertebral articulation. Okay, we're gonna make her lungs do some of the work here, okay? Breathe in, out, in, out, in, out, in, out, in, out. Hear the wheeze, in, out. There it goes. I felt it go. There was a little tearing sensation that happened just now. Breathe in. Better. Out.
Wow.
In. Out. Much better. In. Out. In. Out. Sticky here. In. Out. In. Out. Okay. She's sticky right there too. Okay. So I'm holding tight right here with these two fingers. You can see I'm kind of white knuckling there a little bit. Breathe in, out, in, out, in, out, in, out, in, out. Okay, we got a thunk there. All right. In, out, in, out, in, out, in, out. Okay, I'm actually going to apply. We're going to do a little bit of traction here. Okay, so I'm just going to lean on this a little bit. We got like 3 pounds coming down on here. There we go. I'm increasing. There we go. Good. It's moving. In. Good. Out. There we go. In. Out. In. Out. Yeah. In. Out. In. Out. Good job. Good job. Nicely done, Miss Diane.
Nicely done, Val.
Okay, so that's what we're doing.